Hi, I'm Dr. Jeff West. I'm an ENT doctor in Rockwall, Texas. I've been practicing Rockwall about 12, 13 years now. Been out of residency since 2000. I went into ENT primarily because I grew up with severe allergies and sinus issues and ear issues as a child. I had multiple ENT procedures when I was a child and can relate to my patients. I went to med school at the University of Oklahoma and also undergrad at the University of Oklahoma, and then did my training down in the University of South Florida in Tampa, Florida. I have 4 children, so that obviously takes up quite a bit of my time with their sports and activities. But I'm pretty involved in the community with high school football and different sports as one of the team physicians, and also involved with the local Helping Hands Clinic, which is the local imaging clinic. And also I've been involved with Make-A-Wish for a number of years here in Dallas-Fort Worth area as well. I was used to dealing with chronic sinuses as a child, so it always seems like when you're deciding what field to go into in medicine, it always seems what you can relate to is what you end up kind of, leaning toward a lot of times. And I got interested in ENT because primarily the anatomy. I enjoy the head neck anatomy is very complex, but also the procedures. I do a number of ear surgeries, sinus surgeries, neck surgeries, so there's quite a few different variety of scope of practice and surgeries that we do. Living in North Texas is busy for allergies, obviously, because there's quite a range of environments. The north wind will blow in the weeds and the south wind will blow up mountain cedar. And so year-round, we have something in the air that typically bothers people. So controlling the allergies is a pretty common thing that I do. See a lot of people move here from like Southern California and different other parts of the country. When they move into North Texas, they're very symptomatic from their allergies. There are a number of medications, which luckily now are almost all generic medications now that can control allergies. But as well, we do immunotherapy, not only shots, but also do allergy drops. Drops are real popular in Europe. In the rest of the world, in the U.S., they're not as popular, but they're very effective, almost as effective as shots, and especially for children and patients that live a long ways away, that have long commutes, it's not feasible for their schedules to be able to come in and get shots once a week. But it's a good option for them to be able to improve their quality of life. And once you go through that process, either with drops or shots, usually that immunization lasts 5 to 20 years. Your allergies are improved symptoms. Not only, sometimes you still take medication, but certainly it's, sometimes you don't, and sometimes at least you take less medications. And drops are probably the most popular thing that we offer at our practice. The name of our practice is Lakeside Allergy ENT. We have 3 offices in Rockwall. It's our main office. We also have satellite offices in Wiley and Forney, Texas. Our practice encompasses not only the surgical side of ENT, but also allergy side as well. Frequently, patients with recurring allergy sinus issues will have both not only anatomical issues, but also allergy issues, and we can address both at the same time. We see a lot of children, but also adults, not only for allergy sinus issues, but also for hearing evaluations, thyroid issues, parathyroid issues, throat issues, neck mass. One of the things we do is we do a lot of allergy testing and workup and immunotherapy. Not only do subcutaneous immunotherapy, which is pretty standard, we also sublingual immunotherapy, which is done at home, and it's great for, of course, children. And that's a good way to control the allergies. And then from the surgical side, we do a number of surgical procedures for chronic sinuses, including balloon sinuplasty, which we frequently do in the office, and also inferior turbinate reduction, which we do in the office, which really helps open up their nasal congestion and breathing.